So the next step is to align the left ventricle, the right ventricle, and the root of the aorta. The left ventricle on the bottom is typically going to be more elastic after COVID. The upper ventricle is going to be stiff. On the right side, it's not as prominently different, but the upper right ventricle is also stiff. When the left ventricle contracts, it has to rise and spin and rotate over the right ventricle, left ventricle over the right ventricle, to be able to give the maximum acceleration to the ejection fraction of the left ventricle around the aortic arch. So we have a trouble if the aortic arch isn't lined and if the left ventricle can't roll over the right. So we're going to start with the left ventricle at the space, down or up, medial or lateral, up, medial, clockwise or counterclockwise, counterclockwise. And then I'm going to take the upper ventricle, down or up, up, medial, lateral, lateral, clockwise, counterclockwise. So I've got a relationship between my left hand on the lower ventricle, my right hand on the upper left ventricle. And as I'm just waiting here, the left ventricle is swinging out laterally to the left. So that's a counterclockwise rotation. And the stiffness in the upper ventricle is mixing with the elasticity in the lower ventricle, and I've got a junctional zone right about where my index fingers are, where the more elastic lower ventricle meets with the stiffness in the upper left ventricle. Now we come back and check what that feels like. If we want to, we can roll the whole rib cage around the descending aorta, around the vena cava, around the two thoracic ducts that clear the lymphatics from the lower part of the body, up past the thymus into the subclavian veins. So I'm going to take the right ventricle now, up or down, lateral or medial, clockwise or counterclockwise. And now I'm going to compare that to the left ventricle, which is superior, lateral, and clockwise. And again, the magnetic field kicks in a way that's palpable, at least to me. So now the two ventricles are realigning. They're both coming around clockwise, which means that the right ventricle is getting more vertical. And the left ventricle is following to some extent. We take the top of the right ventricle, the top of the left ventricle. Good. Tight. Now I want to imagine we're going to help get the upper right ventricle out of the way of the upper left ventricle contraction. Down, medial, clockwise. Our next step is to find under the collarbone where the aorta is on the right and the aorta is on the left. The aorta has the most elastin of any part of the body. You can put two palms on and rotate, or you can map with two fingers. And try to locate where is my ascending aorta going to be meeting the top of my left ventricle. Down or up, up, lateral or medial, lateral, clockwise or counterclockwise, clockwise, and here on my left ventricle. Superior, inferior, inferior, medial or lateral, medial, clockwise or counterclockwise. So now we're trying to line up, or let the body line up, the top of the left ventricle and the overall axis of the left ventricle, which we're trying to align from the lower to the upper part, with the opening of the ascending aorta, which has been shown in some research to have become, to some extent, stiff during COVID and post-COVID conditions.